As you saw on World News tonight, the Ebola patient in a Dallas hospital has improved slightly. This as hospitals here vow not to make the same mistakes. New at 7 o'clock, 10 News reporter Bob Lawrence has the common medical condition that they say poses a greater risk than Ebola.
A designated trauma center, the emergency room at Scripps Memorial Hospital in La Jolla, is a busy one. But ever since Thomas Eric Duncan came into a Dallas hospital with Ebola,
we've gone back through again and are retraining our staff.
Dr. James LaBelle with Scripps Hospital. When Thomas Duncan went to Texas Health Presbyterian in Dallas, he admitted he came from Liberia, admitted he had a fever, but instead of isolating him, the hospital sent him home.
As sobering as the experience for Dallas was, it was sobering for every hospital in the West.
Sobering because policies and protocols weren't followed. Hospitals throughout the county regularly train to handle biohazard or chemical emergencies. Every hospital under the Scripps banner, LaBelle said, has reviewed policies and protocols 5 different times since Ebola entered the U.S.
There's a lot of communication that's been going on through a lot of different sectors in healthcare to communicate these lessons.
At Scripps La Jolla, there's even an isolation room where air inside is not circulated to the rest of the hospital. Dr. LaBelle, who is the chief medical officer for the entire Scripps system, said when it comes to the Ebola virus, the reality is this. Ebola can't be spread by coughing like the flu can. In fact, LaBelle said,
get your influenza vaccination. You're at much higher risk of dying from that than you are in Ebola.
Bob Lawrence, 10 News.
And adding to what he just said, here's some perspective on the danger posed by someone with Ebola. This chart shows the average number of people who catch a disease from just one sick person. For hepatitis C and Ebola, that's just 2 people. For HIV and SARS, compare that now. 1 person can infect as many as 4 people. For mumps, it moves up. 1 person typically infects about 10 people. And check this out. For measles, on average, 1 person affects a whopping 18 people.